Hey everyone, it's me again, Christina. I'd like to start off by telling you the date. It is October 7th, 2010, and it is 12:46 p.m., just a little bit just after lunchtime. This is an update from my last video, and I am actually still in the hospital. I'm in U.A.B, Birmingham, Alabama, in the heart transplant intensive care unit. I was admitted in here because of an infection. Today I didn't have any procedures or anything done. The day before yesterday, which was, what's today? Today's Thursday. Okay. Wednesday. Tuesday I had surgery. It's a common thing, and it didn't take too long, and I was wide awake while they were doing it. But they took my perm cath out that was right here in my chest. They opened up the incision, and cleaned out the infection on my chest area. They also put I don't know if you can see this right here, but this is a temporary perm cath, and it's got 3 ports. This one is to draw blood and get medicine taken out, and these 2 are for dialysis. This is just temporary. When they do the draw blood work and the infection shows from the lab work that it's gone and there's no more staph or MRSA, they're going to take this out, temporary one out, and they're going to take me back to the OR and put a more permanent perm cath in, so I can go home on dialysis because I have no other access. I used to have a graft in this arm, and it got infected, so they had to take it out. Another thing is I'm also having another issue, a private issue, and it's just getting worse and worse, and it's getting to the point where, I can't stand it anymore, and it's just growing larger and larger. The reason why I'm not telling you exactly what it is because it is private, and this is going to be posted on YouTube. But the people closest to me, my family and friends, know what the problem is. With it getting bigger and bigger, I had to take a photo of it and show the doctors. The doctors are actually waiting on to see a specialist. They're supposed to come in my room today to talk to me about it. And I have already had surgery done to fix this problem once before, and apparently from what's going on, I'm going to have surgery again. So if I do have to have the surgery again to fix this issue, I'm hoping to have it done, this hospitalization, so I can hurry up and get it done with, and that way I can go home and be with Joe. So it's just a matter of waiting to see the doctor about the issues. As far as my heart is concerned, it's doing so-so. It's like normal. I am still in congestive heart failure. I do have a blockage. It's 75% blocked, but that's normal for me, so they're not too worried about that unless I start having chest pains or go into rejection or anything like that, and then they will follow up with that in case something happens. Of course, the kidney problem, I'm always going to have it, so I'm still doing dialysis. And let's see, if they do the surgery on my other quote issue that's so private, the surgery itself, they put me to sleep, and it's pretty normal, pretty common, and it does have its risks and stuff. But as far as I'm concerned, as long as I have a chance of feeling better, and plus the pain goes away, I don't mind surgery at all. So I will find out more probably today or tomorrow about what's going to happen with that, and I will for sure let you guys know. Um, right now, I'm just trying to take it easy. They've been giving me pain medicines to make sure I'm comfortable because of the surgery I had right here. I have an open wound that they actually, it's not open, it's stitched shut, but it's very, very painful. And the way that they place this thing in, as you can tell, these things, stick straight out. So it's wanting to lean down and it's wanting to lay on the shoulder, but it can't, because if it does, it starts bleeding, and then I have a bleeding issue as well. I've already had a platelet transfusion once. My platelet levels are, I think they said 30,000 as of today. And if I have any other kind of procedures, I'm going to have another platelet transfusion. As you can tell, they took my IV out. The reason why they took it out is because it was old, and they were putting the medicines in, and the medicines were just coming out, out the hole where the IV was. So we went ahead and took it out because it was too old. I'm trying to stay, I'm pretty positive during all this. I'm just trying to rest, and I'll let the doctors and nurses know when I have problems. And if I get too bored, I get up and I go walk around the unit. And at night, I'm having trouble sleeping just mainly because I'm not at home. I'm so used to sleeping next to my husband that, it's kind of difficult sleeping in a twin-size bed by yourself after sleeping next to someone for so many years. And I miss him. I miss him so much. And really, I want to hurry up and go home, but I don't want to go home too soon. And, my infection still be here, and it pops up again, and then we wind up coming back. Right now, I'm actually starting to feel, quote, pre-feverish. I call it pre-feverish because my face and my neck will start burning, my eyes get glassy. Normally, I start having cold chills when I start running fever. But right now my fever is under control. When it does go up, we'll address that issue as it arises. Other than that, I guess everything is okay. It's just a matter of time to see how long it takes for this infection to go away. If you have any questions or you'd like to know anything about my condition, you're more than welcome to post copies on the videos, and I will answer your questions on the next video, and I'll for sure let you know how I'm doing. I will try to do another video tomorrow or the day after. More likely it's going to be on a Saturday because tomorrow I have dialysis. So I guess I will let you guys let go, but for one more thing I want you to do, if you have not done this already, I know you've seen me say this in other videos, but I want you, after you watch this video, I want you to go to www.taylorsgift.org, and I want you to, look around on the website to get familiar with it. There's a little tab up top that says donate or be a donor. I want you to click on that. It's easy. It takes maybe 5, 6, 10 minutes, to go through it. And, when you pop it up and you click be a donor, it's going to ask you what city you're in, what state you live in, and stuff like that, and it give you information. And I'm trying to help get out the awareness of organ donation as much as possible with these videos. As of me being a 2 heart transplant survivor, I'm just trying to, step up and help others like others have helped me. So if this video, or any of my videos for that matter, inspires somebody to go on taylorsgift.org and register to be a donor, then my videos, my goal has been reached. I'm trying to actually get my goal out nationwide, so I can go around and do speeches about organ donation. But right now, I'm just going to have to deal with, work with YouTube, which is, working out very good. But other than that, like I said, please go to taylorsgift.org, register to be an organ donor, and I will give you more updates as soon as I know something. And then I will post a video and let you guys know. Thank you for watching. Take care. Bye-bye.